Welcome to the Health Data Forum Global Hybrid Summit in Wales. We are thrilled to announce the launch of the Health Data Forum Global Hybrid Summit, a landmark event bringing together the brightest minds in health data from around the world. In today's rapidly evolving world, health data is more crucial than ever. This summit will explore how data can transform healthcare, improve patient outcomes, and drive medical innovation. Prepare for engaging keynotes, interactive workshops, and unparalleled networking opportunities. You'll gain insights into the latest trends, technologies, and ethical considerations in health data. This summit is for healthcare professionals, data scientists, researchers, policymakers, and anyone passionate about the future of health data. Whether you prefer to join us in person or virtually, our hybrid format ensures accessibility for everyone. Experience the summit from anywhere in the world. And for those joining us in person, prepare to be captivated by the beauty of Wales, our incredible host nation, offering a unique blend of history, culture, and natural splendor. Don't miss out on this unparalleled opportunity to be part of the future of health data. Register now to secure your spot. Thank you for considering the Health Data Forum Global Hybrid Summit. We can't wait to welcome you.
Greetings, dear viewers. Thank you for watching us again in a live interview, Data First, AI Later. As you all know, this is a series of recorded interviews that we broadcast live on a regular basis in our newsletter, Data First, AI Later. And today, I have the privilege and the honor to have here with me a special guest, Dr. Emma Gordon. Emma is the director of the ADR UK Strategic Hub and director of ADR England. She's responsible for setting the strategic directions for the program, leading on the coordination of the partnership and engagement with senior stakeholders to improve access and analysis of administrative data to inform policy decisions. She's also part of ADR UK Leadership Committee and the editor-in-chief of International Journal of Population Data Science. Before this, Emma was head of health analysis at the Office of National Statistics, and at the start of her career was a postdoctoral researcher on the Avon longitudinal study of parents and children. Emma is going to be with us in Cardiff in the session keynote, Connecting the Dots, the case for public sector data in transforming healthcare, on Friday, 26 September. It's really great to have you here, Emma, today. Good day to you.
Thanks, Paul, and really lovely to be here too. Thanks.
It's really a pleasure. And as we are here, I've prepared a set of questions that I'm sure you also have received in advance. So I hope not to get you on unexpected tone in this conversation. But basically, Emma, we are curious to know what inspired your transition from public service and academia to leading the ADR UK program.
Sure, that's a really good question. So yeah, I worked as an academic researcher for about 10 years and then joined the civil service where I worked for about 14 years. And across both roles, I was sort of on one side and then the other of, how to get access to data to do really important research. And just before I left the civil service, I worked in the Treasury in the UK for 4 years. And it was in a really interesting sort of cross-government role, supporting government economists and social researchers to be able to do their research well. And across all three types of roles, it was a common feature that it was really hard to get access to data because none of the systems and services were set up correctly. So as an academic researcher, I was engaging directly with the data owner, and it was very much on the case of, well, have we done this kind of data sharing before? What do you think about it? Is there a precedent? If not sure, that kind of thing. And then, as ONS, as a gatekeeper of the data, again, setting up processes and protocols that, obviously ONS as a data owner needs to be quite cautious because they hold heck of a lot of really important data. But again, it's sort of helping decision makers make sense of data requests when they can be very, very different from one day to the next. And in Treasury, just finding out how difficult it was to share data across government. All academic researchers assume that all government analysts have brilliant access to data. They generally do to their own data, but it's really difficult, again, to do that sort of cross-sectoral data linkage and analysis. So when I heard that the Economic Social Research Council had a budget to do a pilot programme, really, really well funded, £44 million over 3 years, and this is back in 2018, to really help fix some of the systemic problems of why this is difficult. I absolutely jumped at the chance to get involved, and I was the first director of ADI UK, and I'm still the director so many years on, and it's the best job there is, and I couldn't be more proud of what we've achieved over those 7 years.
Oh, thank you so much for sharing, Emma, and I'm sure the success of your organization relies a lot also on the person you are. We'll go in that in a few minutes, but let me first understand, what do you see as the biggest opportunities and challenges in unlocking public sector data for societal good?
So I think the biggest opportunities, and bearing in mind in the economic social research world, generally, the traditional way that researchers would do quantitative analysis is by surveys. But everybody knows that surveys have biases because some people are more likely to engage than others, particularly in the longer term studies, like the ALSPAC study that I did my postdoc on at the University of Bristol. And unfortunately, there's the particular groups in society that you could argue we should be focusing most on because they potentially have the highest needs are often the groups that find it most difficult to stay in studies like that, just because they have complex lives and they have other priorities. Absolutely understandable. But the beauty of administrative data is any interaction between a person and the government service that administrative data is being pulled from, that interaction is captured. And if you can link that data to other forms of administrative data or census data, which has fantastic information about demographics of the population, you can really gain some deep insights that would not be available to you if you're only analysing survey data. On the challenges, I'd say we've made some fantastic progress in linking some forms of data. For example, our relationship with the Ministry of Justice for England and Wales has opened up a whole suite of cross-justice linked data sets. However, there's a parliamentary inquiry fairly recently that it became clear that the Ministry of Justice doesn't know how many people who end up in prison, for example, have a mental health diagnosis. That's really, really critical information because it tells you, if you understand who the people are that are going to prison, you can start tracking back and think, well, why is this bad outcome there for those people and society, and how do we address that? And linking health data to other forms of administrative data is still really, really challenging, particularly in England. In other parts of the UK, it's a bit easier, but to really build those pictures of people's lives and understand, how one service might be impacting on the delivery of another, that's really, really challenging still.
That's amazing. Thanks for sharing. And Emma, can you share with us one recent project or achievement at the ADR UK that makes you especially proud today?
Sure. So one of our research fellows in ADR England, Dr. Hope Kent from the University of Exeter, has been looking at the double disadvantage of poverty and neurodevelopmental delay. And it's a really, really important thing to look into, because as work from other countries has shown, such as New Zealand, people who have multiple disadvantages are much more likely to end up in the justice system and end up in prison, unfortunately. And if you listen to some of our politicians, then you think, well, it's just easy. People shouldn't, commit crimes. But it is more complex than that. And really understanding, where society and government services might be letting people down. For example, if a child can't read or write by the time they leave school, then opportunities are quite limited to them. And understanding how to support those children better so that they leave school with better life chances is incredibly important. And again, we've not really been able to do this kind of analysis before, just using survey data. So it's absolutely fantastic that we can do research like this. And I do encourage everybody to look at Hope Kent's paper. But yeah, really, really important research that's really shining a light on those with most needs in society.
That's really, really amazing. Thanks for sharing. And just about the success of your organization, I suppose, Emma, relies a lot on collaboration and the fact of you being more in the role of a facilitator, as we discussed that before. What are the essential ingredients for building public trust in health and administrative data use?
I think what's been really transformative is that we can talk about our collective services across ADI UK, and there's one trusted research environment that we fund in each of the 4 UK nations. But collectively, we've got some really high-level principles and ways of talking about them that really resonate with the public, who absolutely have to have trust in how we're opening up research access to this data, researchers who need to be able to understand and to be able to use it, but also, with civil servants, they're the gatekeepers of all this data. They have to have trust that our services and systems and our processes are correct. And we have to be able to hold ourselves accountable to government, to parliament, to ministers, that we're doing this in safe and secure ways. So yeah, the whole principles around the 5 safes and how those have been built into the legislation in the UK, particularly the Digital Economy Act, has been really, really transformative and has helped to kind of explain in one language for all people across all services what we're doing and how it really builds that public confidence, and it allows us to maintain that social contract with the public to be able to use this data for public good.
That's great. Thanks so much for sharing this. In your view, how should nations balance data-driven innovation with ethical and equitable outcomes, especially now as AI grows in healthcare?
That's a really interesting question, actually, and one that we've been pondering a lot over the last year across the ADI UK profession. So to be clear, at present, it's not possible for researchers to go into one of our secure research services and use an AI model or algorithm to analyze data and get the outputs out, because frankly, the checks aren't there to be able to check a model for disclosure, and there's a whole load of methodological reasons why it's difficult. And we also know that we haven't really done enough to bring the public along with us on this journey yet, and we will be putting some quite significant funding towards a public deliberation around this, because if we are going to do this and we are going to develop our services to support new and innovative ways of analysing data, which I absolutely think we should be doing, we need to be doing that with the public in step with us and alongside us, and with us listening to their views and us designing our services to support their thoughts on how this should be done safely and securely and ethically as well.
That's obviously a big concern. We are now approaching the final part of our interview, Emma. I don't want you to cut you off guard as we have a set of questions, but I also would like to know a little bit of what will be the advice you would like to give to politicians who now have the means to allocate resources for data collection in administrative data use.
So I would say that in the UK, we have been able to make fantastic strides that we have in the progress we have, because fundamentally we have a really, really well-funded ADI UK programme. And that has departmental government backing, it has ministerial backing, and we've got an even bigger budget going forward. So our current budget across the entire programme is £105 million over 5 years. Starting in April 2026, it's going to be 168 million, so quite a significant uplift. But when I talk to other people from other countries about how we've done this, it's because we've got that central backing with long-term funding. Without that, I think it would have been very, very difficult to convince government data owners that we were here for the long term and that we were here to support them to be able to open up access to their data. So all of you politicians around the world that are listening, this is really, really important. This is fundamental national infrastructure that you should be supporting, and then great things can happen.
Yes, I imagine so. But let me put here on the devil's advocate, and I'm a policymaker. Please convince me that there will be some quick wins and midterm benefits if I allocate a lot of money to a program like the one you're managing. What will be my end results?
So really, really good question. And there was a program that ran before ADI UK that ESRC ran that kind of fell into this trap of not sort of going full circle and supporting the data owners with products and the outputs from research and feeding that back into policy making. And across ADI UK, we really, really work hard at this. So we run a whole series of mini conferences. We link up our funded research fellows with our government civil servants so that they can be feeding their insights back into policy making. We have civil servants involved in the design of our research fellowship calls so that they can be inputting into the types of questions that can be answered from the data and the types of questions that are particularly pertinent to be that government want answered at the moment. So it's genuinely trying to create that feedback loop. So it's not a one-way process. It's not a one-way system where researchers get access to data and then, complete their own pet projects, which we absolutely want to support as well. But to make the system work, we know that we have to allocate the small amount of research funding that we do have to supporting research that goes into informing government priorities for analysis. And it's working. Government departments really like working with us because we're providing that feedback. And it's about building trust across the sectors as well. And some departments have been on a very long journey with us in this. I mentioned Ministry of Justice. 7 years ago, they didn't have any mechanism to give researchers access to data. And now they're giving access to all of it, through our secure research service that ONS run. But also they've got those links with a whole suite of researchers who are now supporting them and advising them in their decision making.
That's lovely. But before we go, let me also ask you to give us a little bit of an insight of what's going to be the focus of your keynote talk on in Cardiff on our Hybrid Summit later this month.
Yeah, so I'm going to be talking about some great examples from ADR Wales of where it all started, and Wales has been a real beacon of hope for linked administrative data researchers, because they had a good head start with the SAIL data bank that's been running for over 2 decades now. But with our support and our funding, they've been able to expand and take in new forms of data, administrative data from across government, and link that as well. So it's fantastic examples coming out of Wales. But I will also be, very open about where the challenges still are, looking back at some historical examples where it was really, really important to find links, for example, between particular occupations and cancer risks, and challenging us to think, well, would it be any better now? And a whole suite of other examples as well, and be packed full of showcasing fantastic research from across the UK.
That's amazing. Thank you so much, Emma, for sharing this with us. The last question before we go, because I'm sure that we are being watched by early career professionals aiming to make a difference with data in the public sector. What will be your advice for such professionals?
I would absolutely say get involved. So we've got a whole training hub on our website, adruk.org, and there's a huge amount of information, and all the way from just introductory videos through to you can sign up to go on coding courses, on courses related to the analysis of specific linked data sets that we provide access to. And, just think of it in terms of, decades ago, there were people who were building their careers with on the back of brand new longitudinal studies. Well, there's a whole generation of researchers that are the very first researchers of these new linked administrative data sets, who will be the professors and champions of research for tomorrow and decades to come. So, there's huge resources out there. Please do get involved. It's really, really exciting time to be one of the first researchers analysing this kind of data in the UK.
That's really great. I am sure that you're going to be listening here with our viewers. Thank you so much, Emma, for sharing this part of your day with us. I learned a lot from this interview, and it's really amazing to see your work getting results, and it will be great to have your keynote in Cardiff and revealing a little bit more about these incredible projects that make a lot of a difference.
Thank you very much, Paul. Looking forward to it.
It's really great. And dear viewers, thank you so much for watching, and hopefully seeing you soon our next episode, or in Cardiff or online on the 24th to 26th September this month. Thank you, everybody. Take care.
Welcome to the future of health innovation. Are you an innovator at the cutting edge of social impact and health technology? Then get ready to discover a unique opportunity. We are thrilled to introduce the Social Tech and Health Innovation Village, a dedicated space designed for visionaries like you. This exclusive showcase is a key highlight of the Health Data Forum Global Summit 2025. So what exactly is the Social Tech and Health Innovation Village? It's a unique showcase area specifically curated for innovative companies, dynamic startups, and groundbreaking projects. This village is where social impact seamlessly intersects with health technology, fostering collaboration and progress. Curious if the Innovation Village is for you? We're calling all social tech startups, health AI, and data innovators, and real-world evidence enablers. Also, patient empowerment platforms and care pathway disruptors are highly encouraged to participate. And of course, digital inclusion pioneers who are bridging the tech gap in healthcare. Why should your innovative project be part of this village? Gain unparalleled visibility among influential healthcare leaders, policymakers, and fellow innovators. Enjoy direct networking opportunities with summit speakers and key sponsors, fostering invaluable connections. Your company will be prominently featured on the summit website with your logo and project bio, boosting your online presence. You might be wondering, Where exactly can you find this exciting hub of innovation? The Social Tech and Health Innovation Village is strategically located in the President's Room, right in the coffee break corridor. You'll also find a presence in the main lunchroom, ensuring maximum foot traffic and engagement. Plus, your presence will be highlighted on both the official event website and the printed agenda. Don't miss this incredible opportunity to amplify your impact. Join the Social Tech and Health Innovation Village today.